This is a microscopic view of a rapidly dividing tumor cell, and beside it, the pulsing electrical network of human neurons. Standard clinical practice often treats these two systems as entirely isolated. In traditional oncology, encouraging a patient to maintain a positive outlook is widely categorized as a coping mechanism. It is intended to improve quality of life, but it is often regarded as clinically inert regarding the physical progression of the disease. However, the field of psychoneuroimmunology provides a scientific framework that disproves this medical dichotomy. The evidence shows that the central nervous system and the tumor's microenvironment are engaged in continuous bidirectional communication. Cognitive states like optimism, mindfulness, and a sense of purpose are physiologically active interventions. They trigger measurable biological cascades that can modulate the body's internal environment. To understand the impact on clinical outcomes, we must map the specific step-by-step pathway from an abstract thought to a targeted immune response. When we acknowledge the biological weight of mindset, psychological therapy changes from a palliative comfort into a functional component of comprehensive cancer care. We model this process using a system architecture diagram, starting with cognitive inputs, psychological therapies like CBT and mindfulness. These inputs shift cognitive states towards optimism or acceptance. This signal enters biological transduction, converting psychological states into physical signaling within the neuroendocrine system. During oncology treatment, chronic psychological distress creates a persistent state of biological tension. This distress elevates cortisol, the body's primary stress hormone. When chronically high, cortisol acts as a biological immunosuppressant that impairs the mechanisms responsible for DNA repair. Clinical data proves that these interventions work. In studies of breast cancer patients, a 10-week cognitive behavioral therapy course significantly lowered serum cortisol levels compared to control groups. This graph shows the durability of that change. While the control group's cortisol remains elevated, the cohort utilizing CBT maintained lower, more stable cortisol levels for up to 12 months after the intervention ended. Sustained low cortisol provides downstream benefits to the cardiovascular system and preserves baseline organ health, helping the body withstand the toxicity of intense medical treatments. It also helps normalize circadian rhythms, which are often disrupted by stress, allowing for the sleep and recovery necessary for tissue repair. By utilizing these therapies, clinicians are mechanically removing a chemical barrier that can otherwise facilitate tumor progression and inhibit the body's recovery. Beyond simply halting the negative effects of stress, these targeted interventions can actively mobilize the body's powerful immune defenses. On our system diagram, we add a second subbranch under biological transduction, the immune system. Aggregate data shows that interventions which improve mood are linked to a 15% average increase in beneficial immune activity, as shown by this comparison of total immune markers. This includes the activity of natural killer cells, specialized lymphocytes that are critical for detecting and destroying cancer cells. Clinical trials of mindfulness-based stress reduction have documented significant increases in the cytotoxicity of these NK cells, making them more effective at identifying tumor targets. This heightened surveillance occurs alongside a reduction in systemic inflammation. High inflammation provides a biological milieu that supports tumor growth. This scatter plot shows an inverse correlation. As a patient's reported sense of life purpose increases, their levels of pro-inflammatory cytokines, specifically interleukin-6 and C-reactive protein, decrease significantly. Lowering these inflammatory markers makes the internal environment less conducive to the conditions a tumor needs to thrive. Simultaneously, the reduction in systemic inflammation helps mitigate debilitating symptoms like chronic fatigue, improving a patient's ability to function during treatment. These are not fleeting emotional shifts. They are sustained biological states driven by structural changes in how the brain processes the experience of illness. Functionally, these psychological therapies act as behavioral immunomodulators that upregulate the body's native defense systems. While biology changes automatically, mindset also drives the conscious behavioral choices that determine a patient's outcome. A key metric here is coping self-efficacy, a patient's belief in their ability to manage the challenges of their illness and its treatment. This behavioral loop is powerful, showing a strong 0.53 correlation between a patient's self-efficacy and overall quality of life. High self-efficacy transforms patients into active managers who maintain strict dietary adherence, communicate proactively with physicians, and ensure perfect medication compliance. This stands in direct contrast to the impact of hopelessness and depression. As shown in this meta-analysis, patients suffering from depression are at a significantly higher risk of non-adherence, often leading them to abandon their medical treatments entirely. Non-adherence leads to missed chemotherapy cycles and skipped radiation, allowing the tumor to progress without medical resistance. Furthermore, mindfulness and acceptance techniques have been shown to raise pain tolerance, allowing patients to manage symptoms with a reduced reliance on heavy analgesics. Belief in the treatment's efficacy drives patients to endure side effects, maintain their physical performance status, and complete the full therapy course. Ultimately, even the most advanced pharmaceutical interventions require a patient's psychological state to support the completion of the dosage schedule. Looking at the full system architecture, an abstract thought becomes a survival tool, operating simultaneously through biological transduction and behavioral loops. These pathways reinforce each other. Better behavioral coping leads to improved sleep, lowering cortisol, and further strengthening the immune response. To be clear, a healthy mindset is not a replacement for standard medical treatment. It is a therapeutic adjunct designed to work alongside surgery, chemotherapy, and radiation. These indirect pathways, increased immune readiness and better treatment adherence, consistently favor the patient. This dual pathway model targets the specific variables that influence recovery. By optimizing both the internal biological environment and the patient's behavior, these interventions increase the probability of a successful clinical outcome. Addressing the mind alongside the physical symptoms leverages the body's natural systems to work in tandem with medical therapies. This comprehensive approach expands the biological capacity to endure treatment and repair tissue. Integrative care treats the brain as an active medical variable, incorporating the nervous system's influence directly into the treatment plan. Utilizing structured cognitive interventions is not just about a patient's feelings, it is a strategic necessity for maximizing the odds of survival.